All right, it's time for Ask the Doctor. 836-9559, the DJ line.
And you will be on the air if you call that one.
Yeah, if you call that one, we're putting you on.
Come play
on
with us.
And if you want to be anonymous and, all sneaky about it and don't want everybody to know, you can corner me in the produce market because, that happens a lot. And there's that anonymous text line, right, Doc Bryce?
Yes.
What the number, Doc Bryce?
501. 313.
I'm taking this down.
You already have it written down.
I do, but you're supposed to play along, bro.
Don't text and drive.
501.
501.
313
0944.
0944. All right, I got it down.
Don't text and drive.
Yeah, well, if you're going to text and drive, at least be a professional about it.
Or do it at the red light.
Yeah. Well,
Voice to text.
What's the fun in that?
I notice when you're sitting at a red light and you pick up your phone and you start texting or looking at social media,
right?
The light changes green faster.
Oh, it does.
It does.
It's a proven fact.
Yeah,
and you're proven not to notice it as much. And I'm in that car behind you going, "Get off your phone!"
That's another proven fact. Okay, so.
All right.
Good morning, Dr. Smith.
Good morning. We've got several questions, and we can get started.
Absolutely. No muss, no fuss this morning. Let's go to the doctor.
All right. What does toe fungus look like, and how do I get rid of it?
Ooh.
Well, what's funny is I read that as just fungus. I'm like, well, there's a lot of different kinds of fungus. It can look like a lot of things. But toenail fungus, it tends to be, there's two types of things that can affect fungal infections that can affect the feet. You can get a fungal infection of the skin, like athlete's foot. That'll be kind of plaquey. It'll probably be real itchy between the toes. You probably wear a lot of closed-toed, heavy shoes, that type of thing. And I've even seen it get macerated where the skin gets kind of thickened but soft, and it can lead to some pretty deep wounds. I had a patient just within the last couple of weeks that actually had to send to wound care to get all the dead skin out of it so that we could treat it well enough.
That's just nasty.
So if you have a weird rash that's not going away or it's getting worse, please go see your doctor.
It sounds painful.
But you can also affect the toenail itself, and your normal nails are going to look fairly clear and be fairly thin, just like your fingernails. Your toenails should be similar to that, maybe a little thicker than a fingernail.
Mine are like plywood, about 3/4 of an inch thick. And you got to get out the good old belt sander.
If you need a saw, you may have onychomycosis or a fungal infection of the nail. And sometimes it can even make a nail dark. So some people may notice that they have a dark nail. And there's several things that can contribute to that, especially if you're really active and you run. Making sure that you have good footwear is an essential. But if you have anything not looking right on your feet, it's always worth an ask to your doctor.
Well, what about ingrown toenails?
Ingrown toenails are super common. They're from cutting your nail too short. So used to, we just take those out, do that removal process that keeps it from growing back. But that actually, we used to use a chemical that apparently might cause cancer, and so we're not allowed to use it anymore.
There you go. There's your doctors keeping your health in mind.
So what do you do to keep from getting ingrown toenails?
Do not cut that toenail. Let it grow out. Let a professional cut that toenail. If you get ingrown toenails, it means you have lost your toenail cutting privileges. You want to make sure you're not wearing shoes that are tight on the nail, because that's going to cause some discomfort as well. Some people are more prone to it, and on certain digits, certain toes, more common. Most common the first, but some people can get ingrown toenails on the second toe. You want to make sure that toenail is kept as long as the toe itself. You should never cut it so short that you see the skin behind the nail on a toe that you have ingrown toenails on. And the other thing is that you don't want to use a nail clipper that is curved. You want to use a flat nail clipper because you want that surface to be flat. You don't want to curve in the edges. That looks all nice and pretty. It will also give you ingrown toenails.
So how do you know if you have an ingrown toenail?
Usually it hurts and maybe swells. And they'll tend to get infected sometimes. But somehow it doesn't tend to be in normal people with normal immune systems. It doesn't tend to cause a ongoing worsening infection. It just hurts. And once it releases, it tends to clear up pretty quick.
Okay.
But most of the time, there's a lateral nail edge that needs to be freed. And if you can free that lateral nail edge, it'll be uncomfortable to do it, but it'll feel much better. And then the key thing is letting that little edge grow all the way out and then not cutting it too low.
Okay.
So if you go get a pedi, will that help?
Yes, because they are right next to your feet, and they find that edge, and then they make sure that that edge is not sharp. So if you imagine that there's, when you cut your nails and you try to cut it, if you don't cut all the way to the edge, there's now a sharp little point. And if that sharp little
your wife
point,
is going to get you for that.
But if there's a sharp point past that nail edge, it'll fall underneath the nail fold and then put pressure and become ingrown. But what they do, they get down, they find that lateral nail edge, and they make sure that it's smooth all the way down to that lateral nail edge. And so they can round out those corners and make them all look like pretty, but they're going to make sure that they have that lateral nail edge. And then they can actually smooth that out if it's not even, and then that process of growing that nail out doesn't hurt as much.
All right. Doc, did that answer all your questions about your toe fungus?
Well, no, actually, that answered all the questions of the person who asked me.
Oh.
Okay, good. The next question is, I feel healthy, but sweat during the night. My wife has several blankets, and I blame it on that, but the doctor said it could be cancer. How do I know? Is there a test I can have done to feel better about this? Number one, your doctor, you should be seeing them once a year for wellness, and they should be doing an assessment on what your individual cancer risks are and making sure that you are up to date on your cancer screening. I will tell you that if you have cancer that's bad enough to give you night sweats, and it's not feeling hot at night. Night sweats are, I sweat so much, I have to change my clothes, I have to change my pillowcase. It's not a, I feel hot, it's a, I sweat profusely. And it's new, and it's rarely a symptom by itself. Most of the time you have those other B symptoms of cancer. I just feel tired, I'm losing weight, I don't have an appetite. You know, you feel unhealthy. So the fact that you started this sentence with, I feel healthy, but I sweat at night. If you get a little sweaty at night, it's probably because it was 75 degrees in January yesterday, and there's too many blankets, and you turned off the AC. You know, there's other reasons for it that are more common.
You know, you can do what my wife does and have this fan and the ceiling fan, and that gives you a gale force wind that goes across the bed.
There's actually something that you can get for an attachment for a fan that makes it come up under the covers.
Oh, I will shoot her. You know, I'm telling you.
I got to send that to her.
Yeah, you would.
So night sweats can be concerning.
Thanks,
you should talk to your doctor if you're having night sweats. But if you're feeling healthy and you just get warm at night, that may just be how your body functions too. So I wouldn't let it like sit and worry you either. But let it urge you to get your routine wellness. You need that once a year.
Well, now, can't you do like a blood test or something like that, you know, to ease somebody's mind?
It all depends on what I'm evaluating for night sweats, but there are some blood tests that I want to do for night sweats. But in general, if we're suspicious of something that could be a B symptom of cancer, the biggest thing that we need to do is make sure you're up to date on your cancer screening. Right?
Well, there you go.
If you haven't had a colonoscopy in 10 years, it's time. If you thought you needed to wait till 50 and you're 49, so you're not getting it, new guideline, you're supposed to get them at 45 now. If you've smoked for more than 15 years and you've not quit in the last 15 years, and you're over the age, I think it's 50 or 55, you need a lung cancer screening. That's something I'm not seeing getting done around here very often. But there is actually lung cancer screening now. If you were or ever a smoker, you should have had your aorta checked at some point if you're a man. Women, that hasn't panned out so much as being beneficial, but for men, you need a once-in-a-lifetime ultrasound of your belly to check your aorta, which is the vessel that leaves the heart and goes down to the body.
Oh, okay. I thought you was talking about something on the other end.
Oh, my.
And then, so women need pap smears, mammograms, the cancer screening is important, and you don't know what you don't know, but your doctor does. Go see them. And actually, Sam, my scribe, she's got a graphics arts degree as well, and so she's been creating some stuff, and she's very close to having a form completed. Because I had a patient, and I'll say her I think I won't say her first name. It's still generic, but I can't. But she came in and she had a paper that she had typed up, and she had all the medicines and supplements she took. She had her list of her doctors, when she saw them last. She had a list of every vaccine she'd had in recent, every surgery she'd had done, and she just kept it all on a list just like that. And I said, I want to show this as an example, but it has her personal information on it, so I didn't. But I thought, if I made up one to show people what this looked like.
Just a template or something like that.
Well, and then Sam and I both had this same brilliant thought, and she is wonderful at this. She created a template, and so she's ironing out the details, but one that we're going to post to our website to where you can fill it out for yourself and have that same thing for you. So it'll be blank instead of like and I might still try to put some stuff on one like an example, but I think that it would be an easy thing for anybody to have, and it's empowering as a patient. That's one of the things that's important to me, is for you to have control of your health. I will help you as much as I can in that, but when you have control of your health, that's so much better.
Absolutely. And knowing your medical history is important.
And when you're put on the spot, hey, tell me every single surgery you had, you might forget, it's like, oh, I had that one spot they weren't sure about. That
there
they
was
took
tonsillitis when I was 7. I had my tonsils out. I broke my wrist when I was 13, or was I 8? Anyway, you
and then you
can
might
lose
forget.
track.
Well, and you might forget more important things, right? So it's just good to have that out and already, and then that way, that makes a wellness visit so easy. But I really like that. So you should, yes, there are tests, and you should have them done. Yeah, at least a wellness checkup.
Let's come back around to this. Yeah. So, get those screenings and talk it over with your doctor.
Yeah.
I mean, if you're concerned,
and if you don't
there might be actual reason for your concern, or you could be a hypochondriac.
And that's
Either
fine.
way,
it's
your
actually
doctor's
called
gonna let
health
you know.
anxiety.
Oh, hypochondriac. Yeah, I got you.
Yeah.
But if you're concerned about it, be sure to discuss it with your doctor.
Yeah.
All right. It could be nothing. Could be something.
And if your doctor, I'm sure every doctor, I couldn't think of one that wouldn't, but if you don't feel like your annual wellness visit is very thorough, get a different one.
Well, that's how I ended up with Dr. Smith. The last doctor I walked in and said, yeah, you look fine. Maybe a little stressed out. Let me give you this Xanax. I was like, well, I think we need a second opinion. Before you just start getting me all addicted to Xanax. Anyway, All right. So what about this next one? Now, this came from the aisle that the soup's on.
Oh, cool.
Like aisle 4.
No, well, they change the aisles all the time.
Yeah,
so,
I know.
I'm not sure. So please ask Dr. Smith to discuss diagnosis and treatment for ADHD. That usually is something that's diagnosed in childhood. And so most people, that's what we do. Now, what I will say is that there are a lot of undiagnosed adults out there facing the same struggles as attention deficit people face. I would say that I really don't like the diagnosis of ADHD, like the labeling of it, because it's attention deficit hyperactivity disorder. And I would argue that it's not actually a disorder. It's just a different way that your brain functions.
Yeah, my mom had a flip-flop to fix that problem. Right? Pay attention.
Well, and the problem with it being that it doesn't give any space to, if you're what we think of neuroatypical, like autism spectrum, or, high anxiety, or, there's different things that just make your brain work different from other people's. And if you try to work in a typical world and your brain doesn't work typical, you're often labeled that there's something wrong with you, when really it's that there's no space in the world that allows your brain to work how it works, or to train you how to work with your brain and how it works. So I do think that if you're an adult and you suspect it, talk with your doctor. But adult ADHD is not something that I recommend be done at my office. I believe that you need to see a psychiatrist. You need to make sure that you don't have anxiety, or a past childhood trauma that you haven't gone through, because childhood trauma and actually adverse childhood experiences can actually increase your risk of being ADHD. So it's kind of like a chronic stress. When you're stressed out, if you were scared right now, you would do fight or flight. You wouldn't be doing math, right?
Right.
You wouldn't be able to do probably even basic math when you're scared.
Problem solving goes out the window.
Right. Your higher levels of thinking, you don't pay attention because that's not what you're paying attention to, right? And when you live your childhood like that, you can imagine that it's really hard to learn and train to focus on things because you had chronic stress from adverse childhood experiences. And so there's a lot of data now saying that it's kind of a reflex mechanism to cope that we just kind of keep. And so dealing with those types of things, medicine can help, but the biggest thing is, as an adult, working towards goals to improve weaknesses in your life, right? There are lots of things that you can do with a good therapist that will make your life better than just taking medication. Now, medication might make it to where you're more able to do those things, but just taking medication without seeing a therapist is useless, in my opinion.
Well, I mean, there for the longest time, it seemed like you doctors were just handing out Ritalin like it was candy.
Well, and some kids, I think it was appropriate. There are good guidelines for diagnosing ADHD, and I do believe that in a normal setting with the appropriate evaluation, it's fine to start ADHD evaluation and treatment with your primary care doctor. But I still want those kids to see a therapist because we can train you how to work with your brain, especially when they're that 9, 10, 11. They're smart. We should start training them techniques to learn to deal with this instead of only relying on medication. But if you're an adult that has never had the diagnosis, I would highly recommend seeing a psychiatrist. And as a doctor, I'm going to refer you to a psychiatrist.
Well, and, it brought to mind a story that came up in my prep this morning that asked the question, have you ever had this fight with your kid? You tell them to do something, and they ask, why? And you come back with, because I said so. Mm-hmm. Right? Now, I mean, you're a parent. Have you ever used that one? Because I said so. Yeah.
I try not to, but yes, I have said because I said so.
Well, research shows that even your toddlers see that as a lame excuse, parents.
Yeah.
So the kids are smart, and you've just got to help them get through and understand how to deal with each one of their problems. And if you can't figure it out, get some help.
Well, and then also a lot of times if you think your child may have ADHD, then it's can be genetic as well. And so you want to make sure that you are treating yourself appropriately, because what we see, most parenting problems are from an unrealistic expectation. I've had kids in my office for attention disorder evaluation at 4. They all have it. They all have attention disorder.
Again, my mother owned a flip-flop.
So at 4, this is appropriate, right? They're not meant to sit in class for long periods and be good, right?
Sit still.
Well, and then you got to look at how they eat. And then this kid is being kept up till 10 o'clock at night. Kids that don't sleep good, that have any type of attention type, that atypical pattern, they will act crazy when they're sleepy. They don't fall asleep when they're sleepy. They go off the wall. Right? And so making sure that the kid's eating good. If they're only getting sugary stuff, their blood sugars are doing this. And if they're an atypical type person, when their blood sugar's going up, they're crazy. And when that blood sugar comes back down, they're also crazy, right? Or when their blood sugars are low, they are unbearable. They are just, everything makes them fall apart because they feel it so much more. And so making sure that you're doing all the healthy things for your kids, like they have some protein with every meal, that they have at least a snack or something every few hours, and being gracious with them that developmentally they may be different from their peers, and you may need to accept that. One book that I really like is called The Essential Guide to Raising Complex Kids, and it talks about autism, ADHD, and anxiety, and just atypical children. And one of the things being that an atypical child may progress through milestones differently than their peers. It doesn't mean that that child that's nonverbal will always be nonverbal, right? And that's a severe example. But we all know, like with my second, it was like 3.5. I don't know what hit at 3, but my oldest went to school and she just started talking. The day that child got out of the car, all of a sudden my second child is just jabbering up a storm. I don't understand all of it, but hey, who's in here? Why are you talking? And so they hit these developmental bursts, right? That language burst. They start walking. All of a sudden they're running, right? They hit these developmental bursts. Those same things happen to all children throughout their whole childhood in lots of different areas. And when you think about that atypical child, so like impulse control, like if you told me not to do something, the time it takes from me to want to do something to I'm doing it is much shorter in atypical children. That frontal lobe is not developed in any human at that age, and theirs is worse. So having an unreasonable expectation of that child is not fair to that child. And you can imagine, say, and I like to use examples, and the listeners may identify with this. As a child, I got in trouble for something very common. And not like I wasn't beaten or anything.
Well, no, she was sneaking out her bedroom window. Yeah.
No, I never did that.
Uh-huh.
I never did that. But I would get a soda, and I would drink a couple drinks out of that soda, and then I would set it down, and that soda never existed in my brain again, right? And I was not like punished severely or anything, but I got in trouble for this, right? And I'm sure that hit my parents on a couple different ways. We were poor, so it was wasteful, right? And my parents were having to clean up after me, right? Constantly finding these sodas and ants or whatever. There's lots of reasons that would be frustrating. But if you think about it, like that type of thing, punishing a child for what is developmentally appropriate, right? That is something that I struggled with, not because I was a bad kid, right? My brain just didn't allow me to remember that I said it there, right? You punish the child for trying to be good, and there's no reason not to be bad.
Absolutely.
Right? And when I try my hardest, I get in trouble, so what's the point? Right? And you see these kids as they get into their preteen, teen years, they've just been punished for everything with no regard for what would be developmentally appropriate for them, and they don't care. They get in trouble when they try, they get in trouble when they don't try, and there's no difference.
And that can be an issue later on in life.
And what you see is that if you give these kids patience in these areas, frequently they may be as many as 2 years behind their peers in something, right? So in like social interactions, impulse control, atypical children may be 2 years behind their peers. So like that book talked about, it's like ask yourself, when you see a problem behavior, ask yourself, if your child was 2 years younger, would this be problematic? Right? So when you get a 6-year-old with poor impulse control, if they were 4, would this be abnormal? No.
No, probably not.
They all go through a lying phase right around 5. I promise you that if you spank them for lying, they will become better liars.
It just gets better from that point. Yeah.
Because if they lie good enough, they don't get the spanking.
There you go.
So they become excellent. So I would invite them to tell the truth. I would tell them, I think you're worried that you're going to get in trouble or that you feel bad for hurting your sister. I'm going to give you another opportunity because I think that might have been a story, right? Share with them how they're feeling and better ways to process that. Because if you just punish them for lying, they'll get better at it. And so, but that's a developmentally normal thing that children go through at that age. To expect something different is actually our problem, not theirs.
So it might not be ADHD. There could be an underlying issue that can be treated with just to talk to a professional.
And some behavioral changes can help with a lot of behaviors. And not all ADHD needs treated. It's when it interferes with how well they function in life. That's when we need treatment. Okay. And so that's important. Somebody's son wants a lizard. Are there any health reasons to consider or any other reason? I can just say no. Well, as a parent, you have that option, right? And when
I swear, I'll give you just a little bit. This man, it came from a man, was pleading with me for you to give him a good clinical reason to just say no.
Well, again, so getting our children into a position where they would fail and then get into trouble is not being a good parent. So expecting too much from your children is not helpful for them, right? We like to think that, I expect the best, but all you're doing is setting them up for constant failure, right? Instead of just... So if your child is ready to independently take care of an animal, I would say you have a very advanced child, right? Because most children are not. So that would be
look at puppy.
As far as health concerns with reptiles, there is some increased risk for like salmonella, but it tends to be more with turtles. But still, there's some increased risk. The biggest thing for me is that when you're anytime you're set with something, ask yourself, what do you want the child to know, right? In this instance, what do you want him to know that you just told him no? That's not what you want to say. That's not what you mean. What you may mean is that I don't believe you're ready. And there are several different ways of being ready. What do you want to teach a young adult that's bought a puppy, right? There's no one here to take care of that puppy. You better be able to pay for that puppy, to take that puppy to the vet, to have that cage. And I would have my child pay for those things. When you can pay for it, then we can discuss it. And once you have those things and the consistency of your behavior shows that you have procured these things, you have them ready, then we'll go with a fake lizard, right? You got to buy food however often. You got to, change I want to see that you can take care of a lizard. And I want to see that over time. Because when that lizard first come home, it's real interesting, right? But then 6 months later, who's taking care of the lizard?
Yeah, let me tell you, I know who was taking care of the dog.
So that's what you want to teach your child. Because a lot of these little interests, if you say, okay, over the next 6 months, I want you to show me, these are the ways I want you to show me that you're ready for a pet, right? A lot of times that's going to peter out, just like New Year's resolutions. It's gone by February, right? So you may have an answer to your own problem, right? And when they have that interest, that's enough for them to exact behavior changes. That can be a really cool teaching point. But if they're not there, don't worry about it. It doesn't have to be your decision.
All right. And finally...
Craving salt. Is there something wrong with me? Not in and of itself. You may not be eating enough salt. You may need more. But if you have if you're on any medications, especially like blood pressure medications, you may want to be seen about. Or if you have other health conditions like diabetes, obesity, swelling, I would want to make sure that you bring that up to your doctor. So not necessarily is there something wrong with you, especially if you're fairly young and healthy, don't have blood pressure, not on medication. You may just need more salt, and that's okay. You want to make sure that you're drinking plenty of water as well, because those two things kind of go together. Just like if you're holding on to too much water and swelling, you shouldn't eat as much salt because you're going to wear more water. But I would just say that not necessarily is there something wrong with you, but if you have any medical concerns, then I would at least make a visit or bring it up at your regular visit. You should follow up with your doctor occasionally. You should be having an annual wellness visit at least once a year. You're seeing your doctor. And then the other side is that if you have any medications, you should be having a problem visit once a year. And so that means you're seeing your doctor every 6 months. And if you do that, if you keep those regular follow-ups, you won't get to that point to where your list is so long. I did a video recent where they're like, I have a list. And the list goes flying.
You weren't supposed to tell anybody that, okay?
If you're in that point where you have a very long list, it means you didn't see your doctor often enough. And I would recommend keeping those regular follow-ups keeps you from having those acute problems, and bring that up at your regular follow-up. If you don't have one scheduled, then you should have, because you should be seeing your doctor at least once a year. If you're on medications, twice a year, because that'll be a problem visit once and a healthy visit the other, right? And so you should be having those regular follow-ups, so go make those.
Absolutely. And if you're interested in becoming a patient over at First Choice Family Care, because Dr. Smith is quite literally the best doctor in the world, you can check her out online. she's got a bunch of TikTok videos going on. You know,
I'm going to do my smoking cessation technique video.
She's a TikToker.
I'm a TikToker. That sounds terrible.
So, you can also catch this broadcast.
It's my retirement plan, so go follow me.
You know, eventually we're going to sell ads to that. So, you can get this on podcast too, right, Doc Bryce?
Yes.
You can get it on like Spotify and stuff.
Yes.
Yeah.
Wherever
podcast.
you listen to podcasts.
You know, I was actually asked, where they could find our podcasts the other day, and I was like, well, duh, anywhere you can find podcasts. I'm pretty sure we're everywhere.
Google it.
So, there you go.
Hey,
Thank you, Dr. Smith.
One more thing. It's Cervical Health Month. So if
All
you're
right,
female.
so I need to get my cervix checked?
Yes, you should. If you're female and you still have your uterus, the cervix is the bottom of the uterus. It communicates between the vagina and the uterus. And that cervix, you can get cervical cancer. And that's most commonly caused by HPV, but you should be getting regular pap smears if you have a cervix. And so that should come at least once every 3 years. If you're over 30, it may be every 5 years now, but it depends on the testing that was done and when it was done and what the result was. So that's a very personalized thing based on your test result and your age and other risk factors. For cervical health, I just want to make sure that if you are in a position where you have an abnormal pap and you want to try to make your cervix healthier, right? Smoking is one of the number one risk factors for cervical cancer. The virus is first, so making sure that your kids, anybody gets that virus vaccine would be number one. If we don't ever get the infection, you don't get cervical cancer. 99% of cervical cancers are from HPV. We have a vaccine that prevents cancer, and it's the most underutilized vaccine. The key thing is getting that vaccine before they start having sex. And I'm sure you don't want to think about when your kid's going to do that. So just get it done at 11. Like, let's just get it done and not think about it. It doesn't make them any more likely to have sex. So prevention is number one. If you have had an abnormal pap, stopping smoking can help. Take a folic acid supplement. So even like a prenatal, having a high folic acid supplement can actually help clear the body of cervical cancer changes. So if you've had an abnormal pap, stopping smoking and taking a folic acid supplement can help.
All righty. Thank you, Dr. Smith.
Yeah.
Let's go ahead and wrap this puppy up. The roundtable, of course, brought to you each and every weekday morning by our buddies out at Elite Fitness Clubs of Camden. Elite Fitness, located at 1289 West Washington. They have got a January special, the New Year's special going on right now, where all sign-up fees for new members are just $23. That's normally $50, and it ends at the end of January. So get down there today and get started at Elite Fitness Clubs. SAU Tech, check them out online, sautech.edu. Go Rockets. St. John's Place and Washita Nursing and Rehab, the choice for all of your rehabilitation, long-term and short-term needs. Reach them online, stjohnsplaceofarkansas.com, washitanursing.com. We are brought to you by our friends out at Stories Floor and Carpet. They've got a January special, 12 months interest-free financing with your good credit. I believe that thing ends on the 27th, though. So you better call Stories today, 870-862-9446. And remember, you can always visualize. Storiesfloor.com. Upload a photo of your room into the visualizer and see your options. The Sandbar in Camden. Choose the Sandbar for simple salads to mouth-watering steaks and everything in between. Located at 245 South Adams near downtown Camden, it's the Sandbar. You can get your order to go by dialing 836-3003. Everybody's Antiques down in El Dorado. They're located at the corner of Bradley and West Hillsboro. 120 booths, 31,000 square feet. Boy, I've got the mush mouth all of a sudden. Let's see, 9 to 6, Monday through Friday, 9 to 5 on Saturday, online at everybody'santiques.com. And by OCMC's Chemical Dependency Unit, reminding you that you're not alone. Addiction's tough, but you can get through it. If you need professional help, they are the very best. 870-836-1289, 1-800-232-1289. All calls are confidential. First Choice Family Care. There's Dr. Smith and staff. They're always there to help you when you need it. Get a new patient packet at myfirstchoicecare.com. Call the office, 870-800-9002, and bug the staff. They love that stuff.
Yeah.
Yeah. And finally, by our friends out at Mitchlow's Body Shop. When you get into an accident, you need professional help there, too. So if you put it in the ditch, just call
Maria
at Mitchlow's Body Shop.
You could probably even call them if somebody else puts you in the ditch.
Well, there is that. If you get put in the ditch, just call Mitch or Maria. Yeah.
They put me in a ditch, man.
Yeah, dude,
Nobody
man.
puts baby in the corner.
Send me a record. 870-875-1444. Doc Bryce, what you got?
I got Glenn Beck already in progress.
Well, then let's get to it over there, and we're going to get to this over here.